Windsor-Essex County Health Unit's media briefing for Monday, November the 15th. We are going to start with some opening statements from Dr. Nessa Thury, and then we'll move into our media questions. Thank you very much. Go ahead, Doctor.
Well, thanks, Ashley. Colleagues in the media, thank you for allowing the Public Health Service to share these comments. So November is Radon Awareness Month in Canada, and radon is an odorless, colorless, tasteless gas that enters our homes through cracks and drains in the foundation. Long-term exposure radon is the second leading cause of lung cancer after smoking, so it's a significant health problem. In Windsor-Essex, the health unit conducted a large radon research initiative and collected and analyzed data from approximately 3,000 tests over a 3-year period. It was apparent that about 11% of the homes in Windsor-Essex had radon levels above the Canadian action limit of 200, and I can never pronounce this, it's becquerels per cubic centimeter units. So given this, it's important for homeowners to test their level of radon gas in their homes. Since COVID, people have been working, their work circumstances have changed. People are working at home more. They're probably spending more time at home and learning more at home. This has meant that some people have spent upwards of 8 hours per day in the basement home offices or in in-home school environments. And in this context, it's important to test these spaces for radon, and winter is an ideal and perhaps an optimal time to test. In Windsor-Essex, there are 2 ways to test. One is to purchase a 91-day long-term kit online, and that runs between $30 and $50. Or alternatively, a community member can go to the Essex County Public Library and borrow a digital COVID testing device, which collects data for 1 to 3 weeks. A short-term device can help you screen and see if you need to get a long-term testing kit. There is information on radon on the Public Health Service website. This includes information on purchasing the long-term test kits as well as short-term devices that can be borrowed from the library. So with that, we're happy to take any questions.
Thank you very much. Any questions from AM 800 this morning?
Yeah, got one. Last week there was an increase in vaccinations recorded in the area, and we were just wondering whether it was the result of people getting 3rd doses or an uptick in 1st or 2nds.
So we are, I wouldn't say we're seeing a uptick per se in 1st and 2nd doses. We still see 1st and 2nd doses, and you know, the increase in vaccination, includes those 3rd doses. So we're seeing more individuals who are eligible now and going out to receive a 3rd dose.
Any questions from CTV?
Yes, good morning. I know we haven't seen the numbers for today, but with 96 cases over Thursday and Friday, could it be an increase due to Halloween a few weeks ago?
Sure, I think that there are many different possibilities to explain the increase. One is that anytime there's greater human-to-human interaction, especially at close distances, that may be a factor. And you know, typically there's a 2-week lag between, or could be up to a 2-week lag between a group of events and case counts. Also, as the weather gets colder, more people are spending time indoors, and as they spend more time indoors, there's also an opportunity for greater transmission. I think the evidence would suggest that the burden of COVID-19 to the Windsor-Essex community and overall has increased in these most recent time period, as evidenced by the higher case counts in the health district as well as across the province.
Okay, thank you.
Any questions from CBC?
Yes, good morning. In Quebec, they're lifting the mask mandate in high schools. I'm wondering if you know of if anything like that is being contemplated here in Ontario and whether you think it's a good idea or not.
Well, it's hard for me to. It's hard for me to. It's always challenging to predict the future, and items related to mask mandates and institutions are determined by provincial public health policy, and there's always some level of dialogue between local public health officials and the chief medical officer of health and other people responsible for making these decisions. At the current time, I would say, given where we are in the pandemic, that people should wear a mask indoors, should wear a mask when they can't consistently be away from somebody, or consistently maintain a distance of 2 meters. They should try to limit their human-to-human contacts. Stay home if they're sick. Those are all things that we can do to try to manage COVID-19. I think we'll have to make public health policy based on the burden of disease in the community and the vaccination rates moving forward.
Thank you.
Any questions from Blackburn?
Yes, I wanted to ask, just going back to the radon issue, you mentioned that 11% of homes here had levels above what is considered acceptable. How does that compare to the rest of Ontario or Canada?
Yeah, there's in reviewing the data, there's a Cancer Care Ontario website, and we can send you the data elements, but it would suggest that Windsor-Essex is disproportionately affected by radon exposure. I can't quote the exact numbers right now, but it's striking where Windsor-Essex rates with other areas with regards to radon exposure. So if you send us an email, we can send you the link to that, and then you can get the exact data from that.
Okay, I can probably look that up myself too. Now, I know, as you mentioned, there was a study where 3,000 homes were tested. That was a couple of years ago. I guess, is there any plan to do an update to that study?
There's no plan obviously right now or in the very near future, but certainly the health unit is always monitoring trends and data, and so it's always a possibility for the future, but we don't have any short-term plans related to updating the study.
Thank you very much.
And any questions from Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Doctor, you mentioned that the burden of COVID appears to have increased over the last few weeks. What is your message to the community as weather becomes too cold to hold most gatherings outdoors, as people move inside to congregate with each other?
Well, I think the first issue is we need to get vaccination rates up. If we get vaccination rates up, then people are less likely to suffer the adverse consequences of COVID. They're less likely, that individual who's vaccinated is less likely to get sick from COVID, less likely to be hospitalized from COVID, less likely to infect other people, get COVID, less likely to expose someone else from COVID. So I think that if you're currently not vaccinated and you're eligible for vaccine, would strongly urge you to get vaccinated. One of my colleagues posted a video in the American Academy of Pediatrics said it's not just about you, it's about all of us. Getting vaccinated not only helps the person getting vaccinated, but helps the broader community. So I think the first thing is, if we want to try to get control, higher vaccination rates will definitely help. Secondly, it is all the standard public health measures, and they seem, I know it sounds repetitive, but it's the same, which is that to wear a mask indoors, stay 2 meters away from people, minimize human-to-human contacts, wash your hands, all the stuff that we've been recommending up to this point. Recognizing that the winter is a time period when there's greater transmission of all respiratory diseases because people are indoors. We're also concerned about the flu, and we're concerned about the flu for a number of reasons. One is that we're seeing respiratory cases of non-COVID infections potentially increase. And also, if people get the flu, they also, people do die from the flu. They do get hospitalized from the flu. It just adds to one more burden to the healthcare system, which at this point is stretched. Healthcare workers are, I would say, for the most part, have endured a long period of overwork. And I am concerned that we don't want to overburden the health system if we can prevent that by vaccination.
Thank you.
And any questions from Radio Canada?
No, thank you.
All right, any additional questions from AM 800?
Yeah, just one more. In the recent numbers, the 0 to 19 age group drove the new cases. Is that simply, for obviously the ones that aren't eligible and the low numbers of vaccinations among that age group, or is there anything else going on there?
Well, I think it's probably complicated, but I think one contributing factor is that there is a lower level of vaccination among that age group than the overall community. I think that the young people also go to school, and school is a type of setting where people are in proximity to each other for longer periods of time. So I think that too contributes to it. And young people, like others, with the cold weather, are doing more activities indoors. I think that's likely to also contribute to the disproportionate effect of the COVID burden on people of that age group.
Any follow-up questions from CTV?
No, thank you.
Any follow-ups from CBC?
No, thank you.
Any additional questions from Blackburn?
No, I'm good. Thank you.
Windsor Star?
No, thank you.
And any additional questions from Radio Canada?
No, thank you.
All right. Thank you all very much. Have a wonderful Monday, and we will see you again on Wednesday morning.
Thank you.
Thank you. Bye-bye.
Thanks,
Goodbye,
you. All the best.
Thank you.
Bye-bye.